This program is powered by thevirtual.show, making your offline events virtual. Ladies and gentlemen, the host of WEBIT Virtual, Dr. Plamen Russev.
Hello and welcome. Welcome to our wonderful, wonderful program, which will meet us with some of the brightest, bravest, and beautiful minds around the world, as usual. We shall be speaking with leaders, and it will be another Thought Leadership Summit by WEBIT Virtual. Usually, we're hosting leaders, and you know that. But sometimes, we have visionaries. Other times, we have people who give example for everyone to follow. Today, I think it's a wonderful mix of all this, and you will spend 1 hour full of visionary speeches and leadership to follow. But above all, always at the WEBIT Virtual, we speak about stewardship, because it's the crisis like this that require stewardship. And because WEBIT is the Thought Leadership Network, is the network of the people who create the news, is the network that brings back thought leadership in our lives, where it was replaced by breaking news. We're having the people creating these news and sharing their vision for the future. Open, honest, and live. Use hashtag WEBIT and ask your questions to the guests that you will see today in the studio. Of course, in a very, very few minutes, I will be welcoming the host of WEBIT Health Innovation Program, Professor Shafi Ahmed, followed by John Nosta from Nosta Labs, and the special guest, John Sculley. And we're also going to be joined by a wonderful lady from CNBC, Afua, who I see now in front of me, Adom, waiting already in the studio. And very soon you will see her with us here, representing you, the audience, and your questions. Hashtag WEBIT, ask any question that you would like to hear the answer from. And of course, this program will not be possible by support of our partners, and this is one of our partners.
EIT Digital Challenge. Scale up your digital deep tech business. Win international growth prizes totaling 350,000 euros. Apply now.
And now, let's talk about health innovation. Let's discuss how the future of healthcare will look like. Let's make a moonshot together and see beyond it. The best person to help us through this walk and show us his vision along with our special guest is someone who is a WEBIT family member for a long time. We call each other brother. This time we're not going to do it. But I feel for him like this because he's a visionary leader, a person with a big heart, and above all, someone who's been with WEBIT family and you know very well for a very, very long time. Ladies and gentlemen, look who is here.
Professor Shafi Ahmed. Shafi is a laparoscopic colorectal surgeon at the Royal London and St. Bartholomew's. As a dedicated educator and Associate Dean of Bart's Medical School, he was awarded the Silver Scalpel Award in 2015 as the best national trainer in surgery by the Association of Surgeons in Training.
Welcome, Shafi.
Hi, Plamen. Thank you so much for inviting me again to the virtual show.
What do you mean inviting? You're at home, Shafi. How can I invite you?
Of course, and I quite feel at home with this WEBIT family, and you've done an amazing job over the last 6 weeks during this pandemic to creating this thought leadership program with some amazing guests and thoughts that I've really enjoyed experiencing.
Thank you so much. I like your hairstyle. Now we both of us have the corona hairstyle.
It wouldn't be fair for me to not to be a proper brother, a true brother, and share the same hairstyle. Next to the same clothes, of course, Plamen.
Shafi, we already hosted a number of events And obviously, there is a development in the situation around Corona. We already see lockdowns around Europe being lifted, etc. Can you please make a 3-minute wrap up of our last meeting?
Sure. So we've been delighted to have had 2 previous global health summits through the WEBIT platform. The first one, of course, we were in the middle of the pandemic. And so we had experts from Wuhan in China, the origin of the viral infection, and experts talking about the experiences at the front line. We had radiologists, we had public health doctors and primary care physicians who told us what to expect going forward. We also had the other epicenter at the time, which is Italy, and in Lombardy with Professor Cecchini and others talking about the role of Milan and Lombardy in its management of the acute phase of this pandemic. And that was an amazing discussion, of course, putting it into perspective for the rest of the world to learn from and share those experiences. We then moved on to a more global setting for the next one. We talked to healthcare officials and experts from India, from Brazil. We had Senator Lofreda from Canada to our their healthcare system. And also we had the Vice President of Epidemiology talk about the impact from data
Pfizer,
around COVID on that one as well. So we had a global entity. And now, of course, moving on to the next level, which is going to be, of course, the innovation, where we're moving towards. What are the key attributes during COVID and post-COVID? We can look forward to a wonderful panel going together. So I'm really excited about the next 40 minutes, the discussion that might come through and perhaps inspire all of us.
Absolutely. Thank you. The same here, dear Professor. Let's invite our first guest here to the studio, and let's announce who he is.
Dr. John Nosta, founder of Nosta Lab. First and foremost, John is a thinker who is entrenched in a world of science, medicine, and innovation. John is the founder of Nosta Lab, a digital health think tank. He's currently ranked as the #1 global influencer in digital health and generally regarded as one of the top global strategic and creative thinkers.
John, welcome. Nosta, how are you?
I am wonderful. How are you doing?
Thank you so much for joining us together with Professor Shafi Ahmed. Well, we've heard your biography. It's quite amazing. And we've been talking with you. I remember that long night in Moscow when we were discussing all these great topics. But look how everything changes overnight or over months. There are new opportunities, challenges, new everything. So thank you so much for joining us.
Oh, my pleasure. It's great to be here. It certainly is an interesting time to be alive, and it's a very important one too. So I think our discussion today will help push human evolution in new and exciting ways.
John Sculley, CEO of RX Advance, former CEO of Apple. Sculley was vice president and president of PepsiCo and developed the so-called Pepsi Challenge, which enabled the company to gain market share from Coca-Cola. He became CEO of Apple Incorporated in 1983 for a whole decade and had a famous run-in with Steve Jobs. The Apple II division, which Sculley ran, was successful and the only source of cash flow vital for keeping Apple financially alive. Sculley is now trying to solve the problems of America's healthcare system and inspiring the next generation of engineers to make the world a better place.
When I think about healthcare has lagged so many large industries like financial services, like retail and e-commerce, like entertainment, telecommunications, in terms of adopting new technologies. I think the issue is not just technologies. The issue is how do you get a frame of reference that says, let's look at the industry in an entirely different way. For healthcare, that different way is starting with the customer, the consumer. And just like in the early days of Apple, we were empowering consumers with experiences that they had never imagined before. The same opportunities are available in healthcare to empower consumers with experience they never dreamed of in healthcare. I also believe that innovation happens in healthcare much as it did in the high-tech industry in the early days, and that is true innovation takes place on the edges of industries, not in the center of industries. So it's often not the incumbents who are leading the industry at that time, but it's new entrants who come in. They can be entrepreneurs, they can be entrants from other companies. As you see, the high-tech industry is now poised to come into healthcare because it's such a large industry, and many of the technologies that worked in other industries are now being modified and adapted for healthcare. So for me, a lot of the experiences are familiar, and I have been in healthcare for 13 years. So it's been my primary interest, the digital health in healthcare for some time. So I have an advantage of having done this in another industry and now doing it in healthcare, but I've also been in and around healthcare for over a decade.
Thank you so much, John. It makes so much sense to be part with us and to give your vision on the future of health innovation. Now, I would like to invite both John Sculley and John Nosta, along with our host, Shafi Ahmed, to move ahead and to be back in the studio, all of us, and start with the questions, because we have so many questions. Shafi, now back to you and your new and wonderful discussion we are going to host.
Thanks so much, Plamen. Thanks so much for the initial conversation with John Sculley. It puts things into perspective around reimagining healthcare, which is what we're all here to discuss going forward. John Nosta, obviously we've been spending time discussing this future, which has come at pace now. Whereas we've been speaking about for so many years, it seems to be now accelerating beyond anyone's comprehension. So you've been out there on social media, I've seen, talking about COVID, the issues around COVID, technology innovation, the issues around data, etc. Can you just summarize your key learnings so far in terms of where we are in this pandemic and where you think we might be heading towards going forward, John?
Well, Shafi, always a pleasure. Nice to see you again. I believe that what we're seeing are two fundamental issues. And that is one, the intrinsic frailty of humanity. And I'll get back to that in a second. And the second is the amazing potential and capabilities of technology as a partner in our lives. So we had the proverbial inflection point. We talk about it all the time in exponential growth. We've been talking about it in digital health as sort of a construct. But when COVID hit, that truly threw us into a tremendous inflection point. And that forced us to rely on our humanity. And I'm going to talk briefly about the use of models to track disease progression, deaths, and inflection. And while the models were very, very important, they were extraordinarily imperfect, whether it be the Imperial model or the University of Washington. These models were based upon old school, old thinking, and dare I say, old people. And what we're doing now is looking at the convergence of technology to be a partner in being a more accurate model, in being a more accurate diagnostician. So for me, it was really the overlap of two really interesting things. And that's humanity, but also the partnership humanity will have with technology. And I use that word partnership very, very distinctly here, that it's no longer an option. It has moved to become an imperative. And to me, that's what defines COVID-19 and the era that we're moving into.
Thanks, John. And I totally agree with you. I think the modeling is changing, isn't it? What was promised at the beginning is not materializing. Is that because of lockdown? Is it because of measures we've taken? Or do we just get the data wrong? Have we misinterpreted some of the issues around planning and epidemiology, for example? So I'm with you on that one. But I guess, John Sculley, we've all read your book, Moonshots, which is amazing, and it really inspired a lot of us thinking about healthcare as well. Obviously, we've moved that needle forward now. What do you think the key moonshots are for healthcare going forward in the context of the companies that you're kind of promoting or working with? I know you've got a huge interest in a number of areas of healthcare, John. Can you share a bit more of that with us?
One of the things I think about a lot is why haven't digital technologies made a bigger impact on the healthcare industry? I'm speaking largely from the perspective of the US, where it's a $0.6 trillion industry. already there are companies and entrepreneurs who are coming up with amazing new things we can do with sensors, with other technologies. Yet the impact in terms of actually changing the industry is still relatively in the early days. And I think that what we are still going to see ahead of us, and it's something I've been very involved with for about 5 years now, is looking at a different type of data. The data that has been popularized is called typically population health data. It's data that's gathered. For instance, Google gets about 1 billion health-related questions a day, every day, on their search. People are taking anonymized data, population health data, using it to be able to come up with diagnostic insights. Much of that will become important in the healthcare industry. What is still to be scaled is the transactional data. The transactional data is data which is deeply embedded into the healthcare system. It's not easy to extract because the healthcare industry is made up of thousands of vendors with vertical siloed solutions that don't often have interoperability between them. So getting the data out on prescriptions, for example, if you can be able to take the data that's used for the adjudication of reimbursements between pharmaceutical companies and health insurance companies and pharmacies and providers, that data is required in the US to document every prescription in terms of the clinical and medical and related lab data for every script. And yet it's only used for the reimbursement of various monies between pharmaceutical companies and others. That data is incredibly valuable if you can take it through the entire continuum of care and be able to particularly focus on people who have high comorbidity diseases, meaning 6, 7, 8 different diseases, because these are the sickest people and they account for the largest costs in the health system. The big innovation that's going on in the high-tech world today that I'm excited about is smart process automation. This means taking automation and going in and using what is called robotic process automation. This is taking AI, either machine learning or artificial intelligence, as one chooses, and being able to take subroutines, which are called bots, and being able to enable them with the smartness, be able to do simple tasks, but when you combine hundreds, even thousands of these AI-enabled bots, you're able to do incredibly complex tasks. And if you do that as a platform that's horizontal, that goes across the entire continuum of care, you can be able to actually penetrate that $900 billion that McKinsey Global Institute estimates is made up of fraud, waste, abuse, misuse, and avoidable costs. And so smart process automation of transactional data is one of the threshold opportunities that we're just now at the early stages of something that can scale to literally hundreds and hundreds of billions of dollars of cost savings over the next 5 to 10 years.
Yeah, I love that idea. You're absolutely right. And being a clinician in the front line for 26 years, we've seen the enormous amount of waste going to healthcare, the inefficiency of work. I wonder what we'll keep asking more and more money, but actually we need to think about our systems better to make it more affordable. And I totally agree with that, John. That's right. So, John, also we talked about this data-driven healthcare, which we all know is coming. It's kind of where we're heading towards, making more personalized and to offer patients the treatment that they require rather than use it for everybody concerned. What are the barriers to that, John, around data-driven healthcare? Are there barriers? How do we approach this new era and make sure that we kind of navigate it through in a sensible fashion?
John
Nosta.
Sure. Well, there are many barriers. One of the things I just want to kind of riff on what John was talking about a little bit, and I'm reminded of the jazz musician John Coltrane, and I'm going to try to sort of move the discussion into the esoteric a little bit. But what Coltrane says, he doesn't play what's there, he plays what's not there. He plays between the notes. And I think what we're seeing is the ability to look between the data points. And as John articulated in terms of transactional data. It's not just that individual health data point, but it's the dynamic of the whole thing. And that's what's real exciting to me with respect to that. For example, we just go back to Lombardy and the tragedies, the deaths that occurred there. We automatically default to multi-generational living in an older population. And I think that's the human analysis of what's going on. And there's much more of a complicated dynamic. I bet you the surprise will be that it might not be those data points. It might be something that is either hidden between the data points or actually hiding in plain sight. So I would say that the biggest barrier to advancing the game or advancing the ball is the human construct. I think that technology is advancing to the point where the ability of leveraging machine learning and artificial intelligence and all these things that John just spoke to is going to push us in new directions. So the barrier is the hegemony of the system. I think that as a clinician, Shafi, you understand that there's a clinical hierarchy, there's a regulatory hierarchy, things from HIPAA to just the logistical issues around transfer of data. So I think that technology is going to be the big solution.
So yeah, of course, and I agree with you. I think now we're seeing fast implementation of technology. We're seeing less barriers. We're seeing regulatory bodies now embellish fast implementation. John Sculley, your thoughts around regulation, around kind of the barriers we've seen before have been so difficult for innovation to happen. Are we going to be seeing a change now from experiences in your healthcare companies and how fast we adopt these new technologies in the future?
Well, let me give you the U.S. perspective. The U.S. perspective is that the pharmaceutical industry spends $240 million every year on lobbying expense, meaning trying to influence the politicians in their decisions. And the healthcare industry, in addition to the pharmaceutical industry, spends about $150 million in lobbying expenses in the U.S. to influence politicians. And the result is that there is nothing comparable in the U.S. economy to the amount of lobbying expense that goes on in the pharmaceutical industry and the healthcare industry. Nothing even close. In addition to that, you have an industry which has a long history of regulations taking place at both the federal level, and each state has its own regulations. And the result is that it has created a moat around the industry that the incumbents inside the industry, meaning the large health plans, the large providers, the people who have made up the system, the large pharmaceutical companies, don't really want to rock the boat, because the boat has been increasing in value ever since the Affordable Care Act was enacted in 2015, or actually at the end of 2014. It has increased the market value of the U.S. health insurance company by almost 400%. So everybody's making money. Nobody has a big incentive to rock the boat, even though all of these new innovations are possible. So the question is, will this industry be revolutionized, and can we take advantage of these innovations that we've seen technically in other industries? Will they be adopted by the incumbents, or will they be adopted by the new entrants, both the entrepreneurs and the large big tech companies? And that's still yet to be seen, because the penetration at scale of these new innovations is still relatively in the early days.
Yeah, absolutely right. I think you hit the nail on the head there. Certainly the system is broken to a certain extent. How do we unbreak it, relearn, make it different, and reimagine, as we mentioned before at the start of the show? John, carry on. Yeah, please.
What I've been seeing is almost a triple inflection point in the marketplace today, that we do have the technology to advance these fundamental changes. 5 years ago, 10 years ago, or even looking back at the Apple Newton, how a brilliant idea doesn't accommodate the technological availability, will not let that idea come to the forefront. So technologically, I think we're there in many instances. The second one is that from a regulatory, a legal perspective, things like telemedicine are gaining a foothold because we're allowing that to happen from a regulatory and legal perspective. So that's the second thing that I think is interesting that's going to help push this along. The third is the moral imperative that we see in the context of COVID-19. It's not only the right thing to do, but in many instances, it's the only thing to do. Going back to telemedicine, there is no physician with an office that's open, and you don't want to go to the emergency room. So telemedicine becomes a necessity. And for me, and my hope is that once that technological toothpaste is out of the tube, it's going to be very hard to push back in. So I think we're at that sort of triple inflection point. It's pushing that. It's more than a nudge. It's pushing people into that new dynamic. We'll see where it goes though.
Let's take that for a second. Sorry, John. Yeah.
I just wanted to add on to what John Nosta said. Sure. I think the post-coronavirus world that we will see relatively soon is that it's going to be tele-everything. If you go back to the 1990s when online banking first appeared, people were skeptical. They were concerned, will it really be secured? Will it become mainstream, or will it be peripheral to the industry? Well, today, the fintech industry is the financial service industry, and that's an outgrowth of what started in the 1990s with online banking. The telehealth industry has actually been around for about a dozen years, but it's taken a long time to get beyond low acuity care, where people come maybe once a year and have a need for a physician to write a prescription because their child has an earache or some other low acuity condition. I think that we're going to see tele everywhere, and it's going to be for mental health, and it may use bots, it may use texting. It's going to be the use of both voice, but also video. It's going to be doctors who, experimented with it during the coronavirus and said, gee, this is pretty good. I can actually do a lot with this. It's going to be used more within the healthcare industry, a professional health expert talking to other physicians, specialists. So I think it's going to be explosive, and it's going to, just as we see that video is explosive for remote working, we're all using it right now, this conference, I think we're going to see tele everywhere as being significant. It's going to be in every part of the healthcare industry, used by professionals as well as used by consumers with their professionals.
Let me chime in, Shafi, real quick because I think that is spot on. But I also think that we're going to be seeing actually my next dog, I think I'm going to name Tela, because that's going to be a great name. But I think we're going to see Tela 2.0. That if you remember the early days of the web, when people took their selling brochure or their detail aid and they slapped it online, and that became their prototypical web page. Well, a lot of people who are doing meetings, business meetings like we're doing now, people who are doing telehealth, that kind of stuff, they're transferring one experience to the web without much insight around the user experience. We know how the user experience transformed our engagement with web, but I'm gonna introduce something right now, and it's no longer the UX, it's the CX. And the CX is the clinical experience. That's going to make a telemedicine visit extraordinarily robust because we can use things like this to take our EKG. We can use linguistic analysis to listen to our voice, and our voice can search for depression. For more choice, our voice can look for coronary artery disease. There's so many things that are going to make telemedicine and tele whatever into tele 2.0, and that's going to be defined by advancing technology, AI mediated CX, the clinical experience. And that's, I think, where the explosive growth is going to catch on.
So
thanks, John.
Add to that,
John Sculley, please do.
From a business standpoint, you cannot build a successful direct-to-consumer company without consumers contributing recurring revenue. The cost of customer acquisition with a consumer business takes a certain amount of critical mass of promotion to get people to be aware of it. That in the example of telehealth, where the typical telehealth consumer only uses it maybe once, at most twice a year, and it's still a relatively small number of people, that you've got to be able to elevate that experience to recurring events throughout the year. And so that means going from low acuity care to higher acuity care. And it means things like tying into the annual physical, all the things around it, being able to integrate, when someone has a urinalysis or a blood test, and that data is integrated into it. And I think as we move to what is becoming more virtual primary care, not just telehealth, low acuity care, that as that takes place, and as John Nosta said, integrates in, various parts of the clinical experience, we're going to see telehealth become incredibly mainstream. Right now, we have one public telehealth company in the States called Teladoc. Its stock went from 7 billion to 14 billion, since the beginning of this year, largely because of the effects of the coronavirus pandemic. But we're going to see not only that company grow, because they're still in early days of telehealth, even though they're the leader in size, you're going to see other telehealth companies that are going to become successful. So I think it's a terrifically interesting thing to watch, to say, what will telehealth look like, whether it's for the clinicians with telemedicine or for the consumers with virtual primary care. What will it look like 2, 3, 4, 5 years from now? I think it's going to be huge.
So yeah, I agree with both of you, absolutely. And even in my own clinical practice, we've gone from face-to-face contact with virtual clinics, which we didn't think was possible. Yesterday, I was on a webinar with oncologists from India saying that now they're doing teleconsults for oncology cases, breaking bad news, etc., which would never be possible away from face-to-face. We're challenging the paradigm of clinical practice. John Nosta, very quickly, as kind of last few questions. Let's talk about 2030. Let's talk about 10 years down the line. Yeah, telemedicine is obviously going to be much more common. We know that. What do you think is going to happen? What kind of healthcare systems will we have in 2030? Give us your vision of events.
It's a big and bold question. I hope that we will look back 10 or 20 years from now and we will mispronounce COVID. That we'll talk about the Conan epidemic, because it will become less significant to humanity than some gloom and doomers would like to say. I believe the emergence will be our partnership with technology, where data will become the new currency, and that will become the third fundamental window into humanity. We had the telescope, the microscope, and data will allow us to see things, not only to connect the dots, but see between the dots. So for me, I think that we're going to emerge where the clinician can now do less of the heavy cognitive lifting. Right now, when you go to medical school, you have to memorize the cranial nerves. Shafi, you remember that. You could probably recite them now.
Nope.
Do we need to memorize that? Do we need to memorize every step in the tricarboxylic acid cycle, the Krebs cycle? Or can we shift the burden to artificial intelligence that can work together with the physician? Once that happens, once that emerges, a very, very interesting thing comes to the forefront. And that's what clinicians have been asking for every day. That's a higher level of human engagement. So our path to empathy, our path to humanity that we will see emerging now and in 5 and 10 years is actually mediated by the evolution and emergence of technology, where it works together with a partner, evolving a new and unique partnership.
Thank you.
I like how Shafi goes to these questions, like a very brief question. How is it in 10 years? I would like to have one more person with us asking these easy questions. And here it is. I would like to invite Afua Adom. Look who she is. She's a broadcasting journalist and writer at CNBC. Afua is a journalist with over 15 years of experience. And you will hear more from her video business card, which goes to you right now.
Afua Adom is a broadcast journalist and writer at CNBC. She is a journalist with over 15 years of experience working with ITV, the BBC, Arise News, producing and writing and presenting news content and features focusing on sustainability, lifestyle and health.
Hello and welcome, dear Afua. Thank you so much for joining us.
Oh, no problem. Thank you so much for having me. That was a really fascinating discussion that John Sculley and Dr. Shafi and John Nosta were having there.
I never had doubts about it, especially with our host, Shafi, who is asking these easy questions. But now I'm requesting you to start these other easy questions that you have from the audience and from yourself. As a journalist with such a great experience, there is a lot to admire about what you're doing. Particularly for me, you're the founder of Women in African Media organization that advocates for women of color in the media industry. And we shall be talking also further tomorrow with you. Thank you for joining us for tomorrow's Leading Media Forum. But now the floor is yours, and these fantastic guests in our studio have to answer your questions.
They do. They are all mine. So I've got a couple of questions from people who've been watching and viewing on Twitter. So the first one is from @Eric Topol. That's Alan Vathy in the Netherlands. Excuse me. He says, "Will the COVID-19 crisis finally motivate and move health professionals to get in the lead to innovate the present healthcare system?" I'm going to put that out to you guys. What do you think? John, I'll put that to you first. Do you think the COVID-19 crisis will finally motivate and move healthcare professionals to get in the lead and innovate the present healthcare system? This person's in the Netherlands, so I think they're probably talking specifically about their healthcare system, but then this could apply across the board.
Well, I think that you could say that this is tantamount to the asteroid hitting the Earth. And look what happened to the dinosaurs. So the question is, will clinicians, will physicians allow themselves to be functional dinosaurs in an extraordinarily changing world? I don't want to be that cataclysmic, but I think that clearly this is a point where we have sort of a duality, the opportunity to create powerful solutions to clinical difficulties, but also the moral imperative that's pushing it in that direction. So it's a bit of a push and a pull to me. And in my experience, you know, the reason why my mother stopped using her rotary phone was because they didn't make it anymore. And so, you know, sometimes things have to push people. And I think that is going to be part of the clinical dynamic. You know, it's still human nature. So I don't think it's cataclysmic. It's going to push people along in an extraordinary pace, but I think it's going to have a very, very important part in the change of technology's intrusion into medicine.
Dr. Shafi, what do you think?
No, I totally agree. I think this is the new normal, as they say. We're not going to go back. We've reset the needle. And also, I think both the patients and the healthcare workers are in a different space now, Afua, all right? The expectation has changed. I think John's mention of the word CX is a good one. The experience will change. It's really changing. And so I think this is the point of acceleration which COVID has created. And that new world that we're looking at post-COVID is that we're already on a different platform, different plateau, which will accelerate. So I think there's no going back. We are where we are. Technology will be the enabler going forward. And I think the adoption, the translation, and the fast-paced change in healthcare we'll see much more of now as systems now almost put in place to quicken that whole process.
And John Sculley, I'll put that same question to you. Do you think the COVID-19 crisis will innovate the present healthcare system?
I do, and I think it's already started. I spend as much time in the life sciences as I do in health tech, and there is no question in my mind that we will have multiple treatments and multiple vaccine choices to deal not only with this specific version of the COVID-19 coronavirus, but solutions that will be adaptable to derivatives, because as we know, viruses do mutate. So I think that's one of the outcomes, and that's already moving very, very rapidly. There are literally hundreds of potential candidates for both treatments and for vaccines that are under development, and many moving into trials right now. So I think this is going to be technically and scientifically a much easier set of issues to deal with. In other words, how do we deal with potential future pandemics, than how to deal with climate change. The issues of how we deal with this are ones which can be adopted by better things that we can learn from the experiences of, in some cases, a lot of chaos in our own country in terms of how we've dealt with this at the political level. So I think that when you look at something like climate change, that's far more complicated in terms of how do you actually, impact enough changes around the planet to be able to deal with what we know is, an incredibly impactful problem unless we can find ways to adapt to it. So yes, I'm quite optimistic that we'll be able to deal with the post-coronavirus world in a way that the next time when there is a potential pandemic, we'll be able to deal with it far more effectively than we have this time.
Afua, can I jump in for a quick comment?
Absolutely.
So I think John Sculley hits the nail on the head here. It's the difference between climate change and COVID is complex and yet simple. To me, it's the compression of time that we actually have within weeks and months a pandemic peak and decline. We actually have, in the course of days and weeks, hospitals that were either over capacity or empty. And it's that unique compression of time that gives us the interesting perspective of evolution, because we can see the beginning, the middle, and the end, and we can make optimal decisions about not only what we did right, but what we did wrong. So for me, that's a very interesting time about COVID. We usually see the curve start to take off in our lives, but today we actually see the curve go up and go down and evolve to either flatness or additional peaks. So for me, that's a real big insight now that is a tool to help us learn our successes and our errors.
Definitely. Thank you for that. So another question from social media again. What do the panel think about the Haven initiative? Is it capable to make a decisive dent in the health universe? And does the COVID-19 crisis interfere with that? And that's from Alan Baffy in the Netherlands again.
Wow.
Big question.
Okay, I'll start off with something real quick, and then I'm going to go run and hide. Yesterday I tweeted and got a little bit of noise from it because I've heard that their CEO might be leaving. I don't know if that's true or not. But to me, the question was, when you merge two dinosaurs, can you expect to create a cheetah? And I wonder if we really are. Even the Amazons of the world have a contemporary but an old school perspective. Warren Buffett is an old school guy who does what he does really well. But I'm just curious, and John Sculley has talked about this many times, I'm sure he'll chime in, is that innovation doesn't come from that center, it comes from the fringes. And I think that's what's going to happen. So I find it very interesting to see what's going to happen with that organization.
Yeah, well, I know Atul Gawande, who is the current CEO. And yes, he has said he would like to remain as chairman of Haven, but step down from being the CEO. They still have an open position that's been open for some time for the COO position. So I sense that there's going to be a lot of rethinking as to exactly how much can they accomplish, how do they want to accomplish it. As many of you know, Haven was formed by JP Morgan, by Berkshire Hathaway, by Amazon, the three CEOs of those companies, to say, how can we find truly innovative ways of starting with our own employees. If you add up the number of employees of those three companies, it's about, well, it's over 1 billion employees now, because Amazon alone has almost 1 billion employees. So it's a very substantial population just with the employees of those three companies. I think the most important impact of Haven so far is it woke up everybody else, because the sense was, what if these three companies, none of whom are incumbents in the healthcare industry, actually end up doing something that is so radically different from the healthcare incumbents that it does disrupt the industry. So just because of the reputation of those three companies, I think it's had huge impact in terms of starting to wake up the incumbents in the industry. So that alone is a pretty good effect, even though we don't know what the real effect from the Haven work is going to be.
Let me just come into that as well, Afua, very quickly. I think this was a great ambition and great aspiration with saying we can change, transform healthcare, which is kind of what we wanted to hear. And we all wanted it to succeed, of course, because as John Sculley rightly said, they're not part of the healthcare system, they're coming non-biased and think about how you shake it up. Is that the wrong time, I think? I think if you had Haven right now, where there's innovation at plenty, people are more amenable to change, we're seeing more translation, now actually you might see the benefits of those big organizations coming together to change healthcare. I'd say now is an opportunity for Haven rather than a year ago, 18 months ago, when they're thinking about this change. So I'd say put that on hold. Let's see who the new CEO is, and let's see how the world has changed, our ecosystem, to help support their program going forward. So I'm optimistic about the future for Haven.
Nice. I'm glad someone is. Now, to the next question from Twitter. How do we see the role of wearables in the COVID-19 crisis?
Well, I'm with the medical sensor world. Just to give you a context, when I first came to Silicon Valley, it was the beginning of the microprocessor. The first commercial product with a microprocessor was a personal computer. And of course, there's a microprocessor in almost everything today. And what used to be expensive is incredibly inexpensive. The comparable event, I think, is what's happening with sensors. We're still in the early days of sensors, and yet it's growing at such an exponential rate that the expectation is we'll be at 1 trillion sensors in the world within the next couple of years. And the estimation is that this is Cisco who's made this forecast that by 2030, there'll be 500 billion wireless connected devices, 500 billion, and yet there are only 7 billion humans on the planet. So again, these are sensors connecting to microprocessors, connecting to public cloud, to hybrid cloud, to edge servers. So all of these things where data is increasing at the rate of doubling every 2 years. Just think of that. The amount of data we have in the world today will be twice as much 2 years from now. A large part of that is coming from sensors. The really interesting thing is what's going on with medical sensors, because the first generation of wearables were relatively simple in their expectations. Track the number of steps you take in a day. Now we're able to do things like EKG monitoring on an Apple Watch and other digital watches. But the things that are coming next are going to be able to, for instance, the company I'm involved with over in London, we are actually doing non-invasive blood glucose monitoring. We're able to break it down into the electrolytes, so we can look at sodium, potassium, we can look at hemoglobins. We expect to be able to find a digital signature for so many different blood constituents, more than just monitoring the blood glucose. We're able now to do detection of things like melanoma tumors without a biopsy. We're able to look into a lady's breast and be able to do early detection of breast cancer long before mammogram. And we're just one company. And there are many companies that are working on things that'll take advantage of the next generation of advanced medical sensors. And guess what? They'll end up in consumer products. So these most advanced technologies are ultimately going to be in consumer products, whether it's wearable or some other form factor for a mobile device. So we're at the very, very early days, particularly with preventative care and wellness, of how sensor technology is going to become a significant part of the future of healthcare.
I also think that probably an add-on to that is passive data acquisition, so that it's no longer me wearing a watch, but me just walking through a corridor. And I guess the example of that, which is not that new, is just looking at temperature, skin temperature as you pass through an airport. So I think that sometimes data acquisition will be very conscious as we wear our Apple Watch, but we will also look at passive data acquisition. And interesting work from Dina Katabi at MIT is actually measuring a variety of physiologic parameters using no sensors. And this is very interesting in sleep studies, where in today's world they wire you up and they expect you to sleep. So I think that that's going to be an interesting area that impinges not only upon health and wellness and tracking and COVID, source tracing, but also into issues of privacy, which is going to be a very interesting discussion.
I would like to have just to put a little bit of pepper in the discussion. What about the implants? Why only wearables?
So let me come into that very question. Let me come in very quickly about that. One of the things that's been fairly noticeable in this COVID-19 pandemic is the management of chronic diseases, actually, which is a huge burden of healthcare, managed both in primary and secondary care. What we're seeing now is a different model of managing chronic disease like asthma, like diabetes, for example, in the community, with data, for example, driven. And actually in the future, back to the sensors argument, we'll see in the future this whole vision of care in the community much more, the realignment of insurance policies, etc. The cost will change, expenses, and people manage more expectantly in the community using wearables in real time, like John has mentioned, passive data constantly pushed out to either doctors or healthcare professionals or even AI interfaces. So I see the whole of it around data and sensors completely transforming the issues around chronic disease, which we're seeing already with the COVID pandemic.
So
okay,
if
thank you for that.
An experience example, that in the States, about 40% of hospital beds will be eliminated over the next 4 years. And yet the increasing number of aging population, particularly as people live longer, sounds almost contrary to that. Because people have chronic care diseases that often end up requiring professional care. So more and more people are going to be treated, at least in this country, in their own homes. And one of the big issues in your own home is how do you get enough care managers who can come in and help support those people? Well, technology can help. And things like ambient sensors, which means environmental sensors, where you can be able to tell did someone fall down when they were getting out of bed? What is their temperature? How did they sleep last night? Is there some response that's going on that we can measure by any kind of different sensor, and then be able to start to take the next generation of voice digital assistants. Today we're used to the digital assistants being basically a request and respond. You ask a question, it responds very efficiently. The next generation is going to be more like Google Duplex, where it'll be conversational. You won't be able to tell the difference between a human having a conversation with you and the voice digital assistant. Now combine that voice digital assistant with being able to access in real-time data in a person's home. And not only can you report back to health professionals who aren't in that home, but you can deal with a bigger issue, which is loneliness, and making it feel like you're having a conversation with a human being, where you're actually having a conversation with some very smart bots that are getting data about you, from that ambient situation. So we're off to just an incredible future of innovations coming from many different paths of source of technology.
Mm-hmm.
Exciting time.
I hate to say this, but Afua, you only have one more question. And please pick the closest to your heart.
Okay, I'm going to, definitely. So in the UK, we know that during this time of COVID-19, that Black people and people of ethnic minorities have had really, really high death rates. So Black women are 4.3 times more likely to die from COVID-19, and Black men are 4.2 times more likely to die from COVID-19. So how can data analysis, John Nosta, you talked about looking between the data points, how can data analysis help prevent such high death rates should there be a second wave of COVID-19 or any kinds of future virus?
Well, I'm probably going to turn this over to Shafi and to John Sculley, but I think risk stratification may be the most important tool we have in managing COVID. The recommendations through Imperial and variety of models were to address all comers, that the risk is evenly distributed, and while children may not be ill, they can become transmitters of the virus. So to me, if we can establish risk stratification, and that's going to be an interesting dynamic, because I'm not sure it's just things like heart disease. It may be a genetic proclivity that we have yet to discover. So for me, risk stratification and treat these new peaks as they come more effectively with appropriate mitigation and appropriate clinical care.
Yeah, I think in the States, we have kind of a forgotten population that has been particularly at risk with the coronavirus. Example, people in prison who are not able to get the social distancing that we can in better environments. People who come in with high comorbidity diseases, both through their lack of understanding of the risks of lifestyles they may have, that they're eating poorly or aren't getting exercise or haven't had the opportunity to get good health professionals to help them with chronic diseases they have. So many of the people who are actually dying from the COVID-19 are actually dying from other diseases, or at least it's being complicated. And of course, the COVID-19 is a significant contributor to it. But if you look at the people in nursing homes, which has been a almost a scandal in many markets, where many people are dying in these nursing homes. Well, these people often are being given little attention to things that would help them solve problems that they had in their health before they ever got COVID-19. And so it's really put a spotlight on we need much better attention for our nursing homes, particularly in high density population areas like big cities. And we need to understand that there are certain populations that are at higher risk. They may have genetic issues that they have to deal with, and those have to be taken into consideration. But that's kind of been invisible to us because we haven't had a reason to focus on these issues until we had the pandemic that we're going through right now.
I just added my kind of thoughts to that a little bit as well. I've been interested in this area for a long while, very passionate about the inequalities of healthcare and how BAME have been high risk during this pandemic, as you know, Afua. And I ran a webinar last week specifically on this topic. What came out was quite obvious. What we're seeing with the pandemic now is highlighting the gross inequalities of healthcare around the world. And in the UK, inequalities in healthcare here, we're seeing poverty, employment, we're seeing people with poor housing, we're seeing people not getting the treatment they require because of lack of resources. So what is highlighted is, yes, they're higher risk because of comorbidity, and we know the Asian community, for example, has diabetes and hypertension and the metabolic syndrome. We can assess that. John's right about stratification going forward, assessing everyone on risk basis using data. But ultimately, what it comes to is asked as a big question of society. How have we allowed such inequalities to take place, where we're seeing a disproportionate amount of deaths amongst groups at the front line? Yes, these are the bus drivers, these are the taxi drivers, these people, healthcare workers, for example. And we need to rechange that. So hopefully this will give us a kick as a society. So we need to reestablish a much fairer society overall, and healthcare should be much more accessible, and ultimately people should get the care they require. So I think those fundamental things will learn, hopefully, this pandemic going forward.
Yeah, and I do think that the jobs that are being performed by people who are willing to risk their own health to be the front line of dealing with the pandemic, that these have been invisible jobs. We don't talk about them every day before the coronavirus, but these are people who are out spending 7 days a week, risking their health, some people moving from other parts of the country just to come in and help out in the big cities like New York, where we have a particular epidemic going on. And I think that not only is this coronavirus putting a spotlight on the people who are most at risk, and they've been invisible in terms of this risk before because of poverty, because of other reasons. but it's putting a spotlight on the incredible way that people have stepped forward who are the frontline people who are taking care of individuals during this crisis. And I think people are going to start to say, wait a minute, is society valuing the role of these people to the extent of what they are able to do for us to get us through a crisis like this? So I'm hoping that as this decade moves on, that at least in our country and hopefully others as well, we'll put greater attention on not only the people who are most at risk, and we become better prepared for that, but also better reason to increase the value in our capitalism system for people on the front line who don't often get high-profile credit.
Definitely, I hope so too. Absolutely. Thank you so much for answering my questions, panel.
I have some technical issues with my connection, but that's how it is from the mountain. I would like to request you now to wrap up. All of you, we are already beyond time, but that's such an interesting discussion. I would like to really have every one of you 1 minute of your time to focus on the next 3 to 5 years of health innovation. And I wish you join us back to talk things that you've already mentioned. But what happened is that we didn't have time to talk about gene modification, for example, and how it goes that in the future, and how maybe this would be a complete game changer. But now I would like to request one after another, starting with John Nosta. John, please share your vision in these easy questions that Shafi is asking always. Your vision for the next 3 to 5 years distance of where healthcare is heading.
Well, Plamen, I want to thank you personally for what you're doing, because you are actually part of the change that we will see in 3 to 5 years. The New England Journal of Medicine and JAMA are being replaced by organizations like WEBIT, which have now become the principal voices of change and innovation. You know, it's no longer that we have academic centers of excellence. Change happens instantaneously. And bringing these comments, this discussion to the world is exactly the change we will see. So for me, it's organizations like yours and WEBIT provide a collective intelligence that is greater than the sum of any individual that will help push medicine forward. So thank you for what you're doing, because you are a prototypical change in the making.
You're very generous, dear John. Hopefully we do what you say we do. And I'm very grateful for you joining, because people who share their vision make this Thought Leadership Network possible. Again, thank you so much for joining. I'm sure and hopeful we shall be seeing each other often as part of the Health Innovation Program. And I'm not going to insist on a more specific answer here. I'm very grateful for you joining. I would like to request also now the answer from Mr. John Sculley. John, your vision for the next 3 to 5 years, where is it heading? Are we going into wearables, further into the implantables? Are we going further into gene modification? Are we ready in general?
I believe that nothing is holding us back from a technology standpoint to make a significant increase in the role of digital technologies in healthcare. It's not like we have to, invent, something that doesn't already exist somewhere else. What's really needed is we have to adapt things. I gave the example earlier with robotic process automation, using machine learning and AI enabled bots, hundreds of them, thousands of them, to be able to work on these little tasks in a coordinated way to take out hundreds of billions of dollars of cost in the healthcare system. There's nothing that has to be invented there. This is not like we have to go invent an entirely new science in order to do this. This stuff all exists. It's a question of adapting it. And my belief is that you'll see the big tech companies becoming involved. You'll see new companies that have never even existed before becoming major leaders in the next era of healthcare. And we'll see many of the incumbents either adopt or die. So it's going to be a time of incredible excitement, I think, of adapting things that are already understood in the high-tech world by entrepreneurs and high-tech startup companies, but adapting them to be able to work at scale, speed to scale.
Thank you so much. Thank you so much, John. And before I address Shafi, I would like to say a special thanks to Afua for being with us. I'm very grateful, Afua, being with us, and I'm grateful for introducing the questions from the audience and being here with us, representing your personal opinion. I'm waiting to hear more from you, definitely tomorrow, as part of the media panel, which we shall be together with, and hopefully we shall be able to reflect on these wonderful discussions and more. And again, Afua, thank you so much for being with us. Look forward to our discussion tomorrow.
Oh, thank you for having me. It's been really, really interesting. Yes, more tomorrow. I can't wait to delve a bit deeper into this topic.
Thank you. And now we need to wrap up with Shafi. Every end, I hate these ends because I wish we speak more and more and more and more, because there's so many topics to discuss. We had a very interesting discussion with someone who most probably will mention in the next events that we are hosting, the next episodes. But there was a very clear, challenging theme that he actually was defending quite well. He said, in the era of AI, in the era of all the challenges that next week we shall be talking about cyber tech, there are tens of times increased cyber tech attacks, etc. You will hear a lot from top global leaders. We were discussing the merge between healthcare and AI, and he was very clear that we cannot deal with bioviruses now. Can you imagine a combination of bio and AI viruses all together? How challenging would that be, my dear friend? What do you think, Shafi?
It's been a great conversation today, Plamen. And thanks so much to John Sculley and John Nosta joining us from across the pond to us. And thanks to Afua, of course, for the great questioning. My thoughts are really, when you mentioned this something about the future, is quite straightforward. As I said before, the needle has been reset. The engine has been switched on. The rockets have been launched. We're propelling ourselves to a future that we can't even possibly imagine. It's imagination. It's about actually we're widening what we thought was possible. And COVID-19, as John has quite rightly said, has compressed time. Wouldn't it be great if that compression lasts a bit longer so we could actually reflect and reimagine healthcare for the future? And that's my last thoughts to you.
And that's what we are going to be doing in the next editions. And thank you so much for curating and making this happen. I will definitely look forward to see you tomorrow again with us, Shafi. And I'm grateful for making this edition together with us. I would like to announce our meeting tomorrow. There we are with all great participants. And stay tuned. We shall be seeing, today we were talking to the experts. Tomorrow, we shall be talking to experts who follow these experts, to journalists who make it possible for all of us, the people, read and follow what is happening in the health innovation area and what are their thoughts on the future trends. So, dear ladies and gentlemen, dear wonderful WEBIT community, thank you for being with us. Apologies for the technical issues we had in the beginning, but that's technology. And sometimes we cannot overcome all the challenges at the same time. The most important thing is to be back and to make this great program happening. Thanks to all of you who were with us. Thanks to our participants. And I'm wishing you health. Hopefully, that's the most important thing. And we know it more and more with the challenging times like this. Thank you again for joining, and see you tomorrow, same time. Bye-bye.
This program is powered by thevirtual.show, making your offline events virtual.